The health care overhaul is now law, but polls suggest that many Americans aren't happy with the changes that are coming. So there's a new push as well from some Senate GOP members to get a second opinion. Who better to ask than an orthopedic surgeon? Senator John Barrasso, also a Republican from Wyoming. Good to see you, Senator. Thanks for being with us.
Thank you, Jamie.
You have called for a second opinion. You've done it on the floor of the Senate. You plan, as other Republicans do who oppose it, to have an ad campaign and really get out to the people and tell them what you want. What are the chances of getting another opinion?
Well, I'm giving an opinion every week, Jamie, because as Nancy Pelosi said, you have to pass the bill to find out what's in it. Now that this thing has become law, the American people are even more opposed to what was jammed down their throats. The American people are very skeptical. The White House has a whole campaign to try to say what's good about this bill very early on, but so much of what they're promising, they're delivering far less. And even the things that they say are good aren't working out as we get into the details of this. When they talk about the tax advantages for small businesses, well, what now small businesses are finding out, the way to take advantage of some of these tax breaks is that they need to fire employees and pay them less. People that have pre-existing conditions who were promised much are finding out that if they played by the rules and paid high rates for insurance, they're seeing no benefits at all. So across the board, Jamie, this bill is bad for patients. It's bad for taxpayers, the American people who are going to pay for it, and it's bad for providers, our nurses and our doctors who have to take care of patients. And that's why we're trying to repeal this bill and then replace it with things that we know will work to get down the cost of care, to increase access to care, and to improve the quality of care. They're not in this law. Are there parts of it that you think are beneficial to patients? Well, so much of it is really focused, it's not a patient-centered or a patient-focused bill. It has to do with insurance companies, government regulations, and I think really don't focus on patients, which is where we need to center it. We're not allowing patients to buy insurance across state lines. We're not dealing with lawsuit abuse. The law doesn't really give people individual incentives to stay healthy and keep down the cost of their care.
Let me ask you about cost.
This law doesn't allow small businesses to get together.
You mentioned cost as well, and I know many Americans are watching their paychecks and their savings closer than they ever have before. Are you finding now that this is law, that the cost is any different than what was predicted by the Obama administration?
It's the exact opposite of what was predicted by the Obama administration, because the president promised that people's insurance premiums would go down. In fact, they're going to go up. He said that the cost curve would go down. In fact, the Congressional Budget Office that looks into these things said, oh, no, sorry, Mr. President, the cost is going to go up. He said people could keep what they have if they like it. Well, unfortunately, Mr. President, 12 million Americans are going to lose their insurance through work. And now many businesses, including AT&T, have looked at it and said, you know, it'd be a lot cheaper, Jamie, if we just quit insuring these folks and pay the penalty that AT&T would save $1.8 billion by just paying the fine instead of continuing to do what they've done for many years, providing health insurance, because they know their insurance rates are going to even go up higher, Jamie.
All right, Senator, I know these are all the points that you're bringing up, and I know that America is listening. And in addition, they've now spoken in Hawaii at least, and we'll have to see as we get closer to the midterms what decisions they will make in terms of their representation. Do you think this is one of the issues that could change their mind and cause the turnover of more seats from Democrats to Republicans?
Well, I do, Jamie, and in the special elections both in Pennsylvania and in Hawaii, both candidates ran against the health care bill. So even though one was won by a Democrat, one by a Republican, there is bipartisan opposition to this health care law. And this health care law, to me, is so tied to the economy. We have almost 10% unemployment in this country, Jamie, and that's what people are going to be focused on when they go to the polls in November, the state of the economy. Well, this health care law, with the increased taxes and increased regulations and the impact on businesses, is going to make it much harder for people to find jobs. So I think that this health care law is going to make any kind of economic recovery slower and weaker.
Senator John Barrasso, also an orthopedic surgeon, thanks for weighing in on it today. We really appreciate it.
Thanks for having me, Jamie.
Take care.